Hey guys, why am I peeing so much? That's one of the most common questions we get in the clinic after total knee replacement. Usually by the second and third day, patients are like, I am sick of this. I'm in the bathroom every hour or two. What's going on? The simple answer is when you're going in for surgery, they pump you so full of fluids that your body is just getting all of those fluids out. And so it's totally normal to go to the bathroom to urinate every hour or two. Plus, if you are drinking enough water, if you are staying hydrated, that is going to compound the problem. But we know that a common side effect of some of the pain medication is constipation. And so we want to make sure that you stay hydrated. We want to make sure that everything is moving normal. So if you find that you're in the bathroom more than you want, understand that it's just a temporary thing. It could be associated with some of the medication you're on. It's likely associated with all of the fluids they pump in during the surgery. And then it is a benefit when you look at the importance of staying hydrated just to keep the bowel movements happening like normal. So I wish you the best. It will go away. Just be patient with yourself. I'll catch you on the next video.